A survivor story is meant to inspire us. We learn of their tragedy, self-doubt, and eventual triumph. But what about the story of an individual who has survived by cheating death 3 times? Well, RJ Wyndham is that person. His story is not only motivational, it is inspirational. Through the Patient to Patient podcast, you will be captivated and taken on a real survival adventure, meeting global experts and cancer survivors just like you, where no topic is out of bounds. Now, your host, RJ Wyndham.
Welcome to Season 1, Episode 7 of the Patient to Patient podcast. I'm your host, RJ Wyndham, and for today's adventure, we're going to travel to the United States and meet all-around good guy, Dr. Ron Morton. But first, I wanted to give a shout out to our friends at Boston Scientific for making this interview happen. So the clock's ticking. Let's fire up the virtual rocket and head to the United States. So Dr. Ron Morton, welcome to the Patient to Patient podcast.
Thanks, RJ, and thanks for having me today.
No, I appreciate it. I have to tell you, this is a topic and a procedure that absolutely fascinates me. So maybe you can explain in layman's terms what SpaceOAR Hydrogel is and when it first came onto the market.
Sure. So this is a procedure that has, I think, dramatically improved men's quality of life after getting radiation for prostate cancer. It's been on the market for 5 or 6 years. And what basically to describe it, the prostate, as you know, sits right on top of the rectum. Any man out there who's been diagnosed knows that that's the case, is you can feel the prostate on digital rectal examination. But being so close to the rectum, when you undergo radiation therapy for prostate cancer, the rectum can be in the field. And many of the complications of radiation in men who are getting radiated for prostate cancer have to do not so much with radiation to the prostate, but radiation hitting the rectum. So the idea behind the hydrogel was, could something be placed in between in the space in between the rectum and the prostate? There actually is a space there. And could something be placed? I know it probably seems like there's not.
No, it sounds like a shock absorber almost on the car.
Similar, it's a little bit different idea. It's the idea of think about putting a pillow in between the prostate and the rectum to keep the space there. Gotcha. while the patient's undergoing the radiation therapy. So radiation therapy and radiation therapy is given in lots of different ways, right? But standard IMRT therapy lasts somewhere between 30 and 40 days, say. Well, the spacer is designed to stay for 6 weeks, and it sits in that space in between the rectum and the prostate for about 6 weeks. And then after that, it gets absorbed by the body. And so while you're having the radiation, it's pushing the rectum away from the prostate. Now, it's about a centimeter and a half in space. And I know that doesn't sound like a lot, but to a radiation therapist, that's miles. That's a lot of space.
Absolutely.
To be able to direct the radiation beam, the therapy, to the prostate where the therapy is really needed, and avoid hitting the rectum or the organ at risk, which is where the OAR comes from. So the spacer spares the organ at risk, which is the rectum. You don't want to be radiating the rectum. You want to be getting the prostate. You want to be able to get the whole prostate. And so you want to be able to get that edge of the prostate near the rectum. And by putting this space there, it gives you that margin for error so that you can radiate the whole prostate and not risk injuring the rectum.
No, that makes perfect sense to me. Now, like any procedure, obviously there are benefits and then there are risks. So maybe you can address those two topics, the risks and the benefits.
Sure. The benefits have been proven out in pivotal studies. Obviously submitted to regulatory bodies across the world, where this product is available in the United States, in Europe, in Japan, in Australia. It's very widely available, and the benefits are in reducing the amount of radiation that gets to the rectum, and thus improving quality of life and decreasing the number of grade 1, 2, and 3 adverse events to the rectum. Okay. Now, there are, as you say, with every procedure, there's risk, and there's, whatever procedure you're talking about, there's going to be some risk,
of course.
And the biggest risk to this procedure is if you think about placing a needle in the space in between the rectum and the prostate. That it's not a really big space, as you well know. And I can tell by your reaction that you know that.
Unfortunately, I had to give myself a PhD everyone knows if you're a man, you have a prostate, but as a patient, you then have to do a deep dive into white papers and studies and things of that nature. So I do have a layman's knowledge of what you're speaking about.
And so the biggest now when the needle is placed in between the rectum and the prostate, it's done under ultrasound guidance. So a real-time ultrasound. So the urologist or radiation oncologist or interventional radiologist, those are the three main physicians that do this procedure. They're actually watching that needle go in all the way. And then once the needle's in the right spot, before injecting the hydrogel, they inject a little bit of just sterile saline to make sure that the space opens up and to make sure they're in the right exact space. But you can injure the rectum doing this. And that's the main thing we worry about. Other than that, it's a pretty safe procedure.
Oh, excellent. Now I know this is going to be probably an apples to orange comparison, but for everyone that's listening and watching us here on the YouTube channel, what would be the differences between someone that's considering or has already had a radical robotic prostatectomy in this type of surgery?
Yeah, so the SpaceOAR procedure is best done in someone who hasn't had any procedures in the pelvis. For example, if it wouldn't be appropriate for someone who's already had a radical prostatectomy. Those men can get radiation, but the space has been obliterated by the surgery, and so it's really, there's no studies that have shown any benefit to spacing in men who are getting adjuvant radiation after radical prostatectomy.
Okay, so as a urologist, would you have the opportunity? Is there a fork in the road, I guess, is what I'm trying to drive at. If you and I were talking, would you say, option 1 to the right is prostatectomy surgery, option 2 to the left would be SpaceOAR and this type of procedure, or is that not a choice that's available?
So it is, but I think that the way, so all men should be counseled on all options that they have for managing their prostate cancer. And that also, by the way, includes watchful waiting, which is really just following the disease. For those men who have very limited prostate cancers, low-grade, low-stage disease, for which watching it or observation is appropriate. Obviously, there are those men who have more substantial disease, and in those cases, treatment is warranted. Now, treatment, as you've pointed out, can be radical prostatectomy. Most of those are done with a robot today. When I was practicing, we did most of them openly, or external beam or brachytherapy, which are the seeds that are placed in the prostate, or some combination of the two.
Right.
And I think that it's up to the patient to and in collaboration with their radiation oncologist and their surgeon to decide on the best way to treat their particular disease. And you'd have to know a lot more details about the patient, their medical history, and all sorts of factors go into deciding which is the right decision. Now, once a decision is made that maybe radiation is the right way to treat the patient, that's when the SpaceOAR Hydrogel comes in. Because if that patient wants to avoid the dosing of radiation to the rectum, once that decision is made, then you would decide whether or not they're a good candidate for the hydrogel. And I think that it's especially if the dose has to be high. And when I say that, what I mean is contemporary radiation therapy is moving towards what's known as SBRT or the CyberKnife. You may have heard it called CyberKnife, where there's fewer sessions but at a higher dose. And in that setting, the risk to the rectum is a little bit greater. And that's where hydrogel spacing seems to provide the greatest benefit, although it still provides benefit in more standard therapies where you get like IMRT or, where you get sessions drawn out over approximately a month's time.
Now, let me ask you a question, because I get asked this all the time from men that are, say, 40 all the way up to 80. With a procedure like this, would there be any concerns about sexual function after this type of surgery?
So I think that there's always a concern after treatment for prostate cancer. We all know now through all the efforts of Dr. Patrick Walsh at Johns Hopkins where those nerves are. They run right along the prostate on either side. And if it's surgery or radiation, there can be an injury to those nerves that can result in loss of sexual function. The placement of the hydrogel itself is right in the midline, so it doesn't really pose a risk to the nerves. But the treatment that you get afterwards, the radiation, that we all know that to some degree that can affect the nerves, and obviously robotic surgery removal of the prostate can have an impact on the nerves.
Oh, absolutely. Now, in closing, I know Boston Scientific is always at the cutting edge of the products that they do have available. I know that there's AMS 700 and AMS 800. If you could just briefly touch on those two products and how they can benefit men going forward.
Sure. So the AMS 700 and 800 were specifically designed to treat the potential side effects after treatment for prostate cancer. And with the idea that the cancer treatment itself is life-saving, but we want to also preserve quality of life after the surgery, and also dignity. I mean, I think that you hear stories about men who've been treated for prostate cancer, but now either because they're leaking urine, they don't go out of their home or anything like that. And we want to restore that for men. So the AMS 800, which is the artificial urinary sphincter, allows men who have suffered urinary incontinence after prostate cancer surgery or radiation to now be continent again. And that it's a pretty straightforward procedure. It can be performed by any urologist, but there's a sort of a subsection of urology called prosthetic urology or prosthetic and reconstruction urology. And those surgeons generally have the most experience with placing the device. And because they do it more frequently, probably, have somewhat better outcomes. The other complication, and we touched on it earlier in the talk, is ED or erectile dysfunction, which can happen when there's an injury to the nerves during radical prostatectomy. Now, and we know now that many men who undergo radical prostatectomy or treatment with radiation can have moderate ED, which can be treated with a number of oral medications that are out there. And I'm sure that men are aware of those medications, but sometimes that's not possible. Sometimes the damage is severe, and those medications won't work. The AMS-700 is a device that is an inflatable penile prosthesis that gets placed within the penis. A pump is placed in the scrotum, and there's a reservoir tucked in the abdomen for the fluid. And so by manipulating the pump, one can generate an erection. And then after one's done with the event, you then use the pump to bring the penis back into the flaccid state. It's a very natural appearing penis. You know, if you're in the gym and somebody doesn't know you've had this surgery, they wouldn't be able to tell that you have that. And so it's again, the idea of restoring dignity and a sense of, well-being to men after treatment for, you have to get your cancer. In many cases, you have to get your cancer treated. Right. We don't want you to feel less of a man or less whole afterwards. And so these are, I would say that, one of the things that's been studied and has been shown to be a result of some of the complications of radical prostatectomy is depression. And huge topic. And we know that by restoring erectile function, you can have a very positive impact on depression seen in men after prostate cancer therapy. So it's not just a purely quality of life issue just to restore sexual function. It really goes more to the whole person and their perception of themselves. And that's a big part of, and just, I would equate it. It maybe not the entire same thing, but breast reconstruction in women after mastectomy for breast cancer. It's the same idea of restoring that wholeness of, and making sure that they feel like they're no less of a person than they were before their cancer treatment.
That is so well said, because I actually wrote about this in my first book. Now, being raised by all women, I'm going to tread lightly and not speak for anyone else. But it's such a Herculean task of recovery, and that there's a shared mindset, shared experience that breast cancer, especially someone that's had a mastectomy, what I guess the Herculean task of recovery is kind of on a straight line with that of a person that is recovering from, say, a prostatectomy or this type of surgery or any type of cancer surgery. The mindset is the same. So in all of the products that you just discussed, along with SpaceOAR, I can see how 50% of it is, addressing your cancer, and then the other 50% is curing the mental aspect of recovery. So I really appreciate you, touching on all these topics. I know you're such a busy person, and I really appreciate your time. And I want to thank you for joining us here at the Patient to Patient podcast.
RJ, it's been a pleasure to speak with you. And anytime I can come on and be of help, I more than welcome the invitation.
All right. Well, listen, thank you so much, Dr. Morton. And we'll be speaking soon, I'm sure.
Sure. Great. Thank you.
Well, that's going to do it for us today. Be sure and check out the free resource section at rjwyndham.com. And remember, a journey is something you do on your own, but an adventure is done with loved ones and friends. Until next time, I'm your host, RJ Wyndham.
Thanks for joining the Patient to Patient podcast. If you enjoyed this episode, make sure to like and subscribe for free. If you know of someone that could benefit from today's show, make sure to share this episode with them.